Hi, I'm Dr. Jeff Borenstein, editor of Psychiatric News, and I'm here with Dr. Paul Summergrad, the president of the APA. Paul, you've had a very busy year, and I'd like you to share with us the highlights of your presidential year.
Well, first of all, thanks so much, Jeff, for inviting me to come talk with you. It's been a whirlwind of a year. It's been very meaningful and very important in a whole host of ways. There are lots of things that come up that are just incoming kinds of things you have to respond to, but there's also things that involve longer-term planning. Probably the most important of those was really to make sure that we began to do a multi-year planning around what are the things we need to focus in on for the American Psychiatric Association. So the board commissioned a strategic planning process which began at the beginning of my presidency with a retreat in Boston and concluded last March. And out of that, we really came up with 4 key areas that we think it's essential that the APA focus on. Now, this doesn't mean we stop doing everything else that we're doing, but the first one is really around the integration of psychiatric care with the rest of healthcare. We know that there are enormous changes occurring in the workforce, in the practice of medicine, in the financing of medicine, and consequently we need to make sure that we can help psychiatrists and make sure that psychiatrists are well represented in new healthcare systems as they evolve. It doesn't mean that we think the private practice of psychiatry will go away, nor should it, but there's lots that's changing, and it's changing for all of healthcare, and psychiatric care is simply too important to be left out of that. Secondly, as part of that, we really think we need to enhance our member services and services to our membership so that they can have the tools that they need to be able to function in the way that they want to function effectively in a changing healthcare environment. Secondly, we think it's critical for the APA to be a strong advocacy organization, particularly around research, which is a critical aspect of what's going to make a difference in the transformation of people's lives. There's just been a wonderful set of discoveries that have occurred in both genetics, neurobiology, and it's critically important that the funding is there and the advocacy is there to achieve that. And then in addition to education, both residency training, medical student education, and education of physicians, not just psychiatrists, and the general public. So those are all things that we're working on. And then the fourth element is really diversity. And we know that we have a diverse membership, we have a diverse country and population, and it's critically important that we reflect that in the work that we do. And so that's going to be a critical component of what we do going forward. Undergirding all of this has to be excellence in the way in which we communicate, which, and we're so grateful for all of the things that you do, to make sure that both internally to our membership and externally to the rest of the world, people understand what it means to be a psychiatrist, that we're physicians, that we take care of people in a whole host of ways. I recently came back from California and was meeting with one of my former trainees who is the executive vice chair of a department of anesthesiology. He trained in internal medicine, psychiatry, and pain management, and he does pain care, which is really both a lot of psychiatry, but also it's a lot of in the operating room interventional work. People don't ordinarily think of psychiatrists as doing that, but that we are, and we do a whole host of other kinds of things. So it's important that the world understand that. In addition, we worked a lot on healthcare reform. We worked on guidance around longer-term plans around education and training of psychiatry residents to make sure that that really remains robust and is well suited to the current environment, both in terms of neuroscience and as well as the other aspects of integration of care. And in addition, a whole host of other kinds of things that came up that were really around responses to the environment that we found ourselves in. So, for example, the ability to respond to mischaracterizations of psychiatry, whether in one or another print media or on television. Our communication staff worked on that. However, I would say of all of the things that were meaningful and important to me, it was really a discovery of really how important the American Psychiatric Association is to other policymakers, to other organizations, to the general public, and how much of a concern there is about mental health and mental illness in the society. And that is actually growing. People are becoming more open about discussions about this. And what's critical is that we are viewed as the trusted physician resource around psychiatric illness, mental health. And there's no other physician group that serves the role that we do. So it's absolutely essential that we do things well, we do them right, and we really speak on behalf of patients and families. And that's ultimately our most important responsibility. And it has been since 1844. You know, we're the oldest medical specialty organization in the United States. We're 5 years older than the American Medical Association. And the reason for that is because the care and the evaluation and services to people with mental illness go back to the beginning of the Republic, to Dorothea Dix, to founding of asylums in this country, which is our history as well. So it's been a very great honor to serve. There are wonderful psychiatrists doing wonderful things all around this country. Many of them are unheralded. There's amazing research going on. We have these wonderful academic departments that are not only doing extraordinary research, but they're also doing amazing kinds of care, both very high technology, complex care, but also they're the bulwarks of our Veterans Administration hospitals. They're the bulwarks of many of our state-based mental health systems. They're providing a lot of care to people who are indigent and not of means. And they're also taking care of people with medical and psychiatric complexity that no one else is really well positioned to take care of. So all of that's been a great honor and a great joy.
Well, I want to thank you for joining us here today and wish you the best of luck at this meeting, which is very exciting. And also thank you for your leadership. You really have taken that role very seriously, but with joy. And that's come across throughout your tenure.
Well,
and I want to thank you very much.
Thanks a lot, Jeff.
Thanks.
Right. Bye-bye.